If your thyroid's not working properly, the rest of your body just isn't going to either. And with all those issues, a normal TSH doesn't guarantee optimal thyroid function. A true functional medicine approach looks at evaluating a full thyroid panel in addition to patient symptoms to get a bigger picture of what's going on with thyroid function. When patients take both forms of thyroid, T4 and T3, they have better overall quality of life, better symptom control, and feel a lot better. Welcome to The Trusted Pharmacist, where you'll learn the truth about how the body works. Welcome back to The Trusted Pharmacist. What if I told you the number 2 most prescribed medication in the US isn't fixing a problem at all that it's supposed to be fixing? And that what if your fatigue and your brain fog and your weight gain aren't in your head, but actually an out of balance hormone issue? Today on the Trusted Pharmacist podcast, I'm going to give you the truth about thyroid dysfunction and why conventional medicine just keeps on getting it wrong. We're going to uncover what standard labs get missed, why so many people are still symptomatic on medications like levothyroxine, but also how stress, your gut health, your nutrient status, and how other hormones all tie into your thyroid performance. So if you or someone you love has been told your labs are normal, but you don't feel that way and you think it's thyroid problems, this episode is for you. Let's start with this. Over 20 million Americans have some form of thyroid disease, and more than 60% of those don't even know they have a condition. Women are about 5 to 8 times more likely to develop a thyroid problem, and in fact, 1 in 8 women will be diagnosed with a thyroid disorder at some point during their lifetime. But to understand all this, we need to take a deeper dive, and let's do that. Your thyroid gland is this little butterfly organ that sits right in the middle of your throat. But it has so many effects on so many parts of the body, and we need to look at those so you can better understand if your thyroid's not working properly, the rest of your body just isn't going to either. First, metabolism and energy. Your thyroid gland can actually control your basal metabolic rate. This is how many calories your body burns while you're just sitting still. It controls the ability of the mitochondria to produce energy and also can control and regulate your body temperature. Thyroid is key for brain and mental health. It helps with memory, concentration, and focus. But in addition, if your thyroid is off, it can lead to things like anxiety and depression. And actually, in pharmacy school, I was told if somebody comes into you and has depression, one of the first things that should be checked is whether or not they have proper thyroid function. In terms of cardiovascular health, your thyroid function actually can regulate your heart rate. Low thyroid issues can actually cause a slower heart rate, where hyperthyroid issues can actually speed up your heart rate. In addition, it has the ability to control your blood pressure, and even when your thyroid is low, it actually can increase some of your cholesterol numbers in a bad way. Proper thyroid function is essential for bone and brain development in children. In addition, as we get older, it's important for our overall bone health. You might not know that with low thyroid function comes muscle issues. Our thyroid is needed for proper tone and endurance. And when we have low thyroid, this can lead to cramping, weakness, and stiffness in our muscles. One of the hallmarks of low thyroid is temperature regulation. How many times have you heard somebody who has low thyroid say, I am so cold? Because your thyroid gland actually regulates how well your body preserves and controls its body temperature. You might not know that thyroid has a big impact on reproductive health. It has the ability to trigger irregular cycles, cause infertility issues, and even lead to miscarriages. Your thyroid production has the ability to control your ability to produce estrogen, progesterone, and testosterone. And we always talk about the importance of gut health. Well, guess what? Thyroid plays a role there. If you're low in thyroid, this can lead to constipation. If you have an overactive thyroid, this can lead to diarrhea. In addition, your thyroid has the ability to affect the liver function and how well your body produces bile, which is critical for your overall digestion. What about kidneys and fluid balance? Your thyroid has the ability to control your sodium regulation and your hydration. And when you're low in thyroid, this sometimes can lead to fluid retention and make you feel a little puffy. And finally, the big hallmark symptom of thyroid issues are problems with your hair, your skin, and your nails. Quite commonly during low thyroid times, we're going to have problems with dry, coarse skin, brittle nails, and thinning hair. And typically, this is what I see drives most people to go to the doctor. But keep in mind, even if you have an overactive or high thyroid, this can cause you to have hair loss also and make you feel very warm and sweaty throughout the day. Let's jump into thyroid function. Your thyroid gland produces several thyroid hormones, but the 2 main ones are T4 which is the inactive form of thyroid, and T3, which is the active form of thyroid. T4, the inactive form, has a long half-life, which means it stays around for a long time. And T3 has a short half-life, which means your body produces it and it gets cleared very quickly. Your body mostly produces T4, that's the inactive form, at about 80%, and about 20% is T3. But what's crazy is the body actually converts the T4 to the T3 in other parts of the body. It uses something called a deiodinase to take and make it from the inactive form to the active form. Some of this happens in the liver, the kidney, but some also happens in the pituitary and the brain. And actually where this happens at can affect how well your thyroid functions and whether or not you have symptoms. When your body produces these thyroid hormones, they don't just float around in the blood. They're on something called a thyroid binding globulin, which means they're bound up and not free. And that's important a little later, as we'll discuss. They also can float around on your albumin, as these thyroid hormones just can't float around free and by themselves in the blood. In terms of the activity, your T3 is about 5 times more potent than your T4. We talked about all the ways the thyroid gland affects other parts of the body. And when your body parts and your different organs don't get enough of the active T3, even though your labs may say things are normal, this is when you begin to experience low thyroid symptoms, which are the things that can drive you crazy and be like, I've got to get these taken care of. And as you can see, if we don't fix our thyroid, it can lead to a whole host of other problems throughout the body. So if you're having the low thyroid symptoms I mentioned earlier, and you go to a medical provider and you ask them to check your thyroid function, sadly, a lot of times they just check one thing, and it's something called a TSH. This is thyroid stimulating hormone. This is a hormone that's produced in the brain, not the thyroid, and it measures how much the pituitary is signaling for thyroid need. A high TSH often means you have low thyroid function, but this can be misleading due to the pituitary sending this signal and not the thyroid or the rest of the body sending the signal. TSH reflects the brain's need for thyroid hormone and not what your cells are actually getting. It measures how much the pituitary is calling for more thyroid hormone, but not how well the body is utilizing the T3 at the tissue level. And unfortunately, there's a lot of the things can get in the way to make this TSH not be an accurate reflection of the tissue level of your T3. So we talked about earlier, the body uses something called a deiodinase to take the T4 and convert it to T3. Well, there's different forms of these. Certain deiodinases can work well in the brain, so the brain's getting plenty of T3. But if these deiodinases are not working well in the body, it can leave the body or the cells needing more T3, and this can be a problem because now your cells of the body and the brain aren't really talking real well. And when this happens, your TSH will look normal, but if you look at the T3 levels in the cells, they may not be adequate to get proper function, and you're going to start having low thyroid issues. And here's where this gets messy. This TSH number can be suppressed by a lot of factors unrelated to your thyroid health. Things like chronic stress, elevated cortisol, inflammation, aging, just getting older, insulin resistance, and certain medications like steroids, certain vitamins like biotin can actually suppress and make this TSH lower than what it is. And remember, when your TSH is lower, that tells your body you don't need as much thyroid. And with all those issues, a normal TSH doesn't guarantee optimal thyroid function. And studies have shown that patients can remain symptomatic even if they're taking thyroid medications like levothyroxine. And despite that therapy, they still have a normalized TSH, but they still have a lot of symptoms because of the issue we talked about. You can have issues where you have a brain normal amount of T3, but the tissues aren't getting what they need. And to make it even a little more complicated, there's an autoimmune condition called Hashimoto's, which is an autoimmune thyroid condition where your TSH can be radically off because the thyroid gland is being destroyed. And when this happens, that's why we need to take a little deeper dive into our actual thyroid numbers to understand what's going on with our thyroid. A true functional medicine approach looks at evaluating a full thyroid panel in addition to patient symptoms to get a bigger picture of what's going on with thyroid function, so then we can look to correct the things that we need to. So in addition to TSH, which I like to see at about a 1.5, here are the other labs that can be run. First is something called a free T4. This is the amount of T4, the inactive hormone that's in the blood that's not bound by albumin or by thyroid binding globulin. It represents the inactive hormone circulating around that can be converted to T3. Low levels of a T4 typically indicate you have a low production of T4 by the thyroid gland. Next is free T3. This is the active hormone your cells can use. Often this is the last thing to drop, but the most important in how you feel. A low free T3, despite a normal TSH, can explain all the symptoms why quote unquote things can look normal, but you have all these thyroid problems. Next is reverse T3. If we said the T3 is the active form of thyroid, think of it like the gas pedal. Reverse T3 is the brake, and your body produces amounts of these to keep everything in check. But this reverse T3 is a storage inactive form of T3 that can block and work against T3 from doing its job. And if you see high amounts of reverse T3, this can make you have low thyroid symptoms. High levels are typically indicated by stress, inflammation, or poor conversion of T4 to T3. And finally, if you have low thyroid symptoms, at some point, your provider needs to run some thyroid antibodies. One is called TPO, or thyroid peroxidase antibody, or TG antibodies, which is thyroglobulin antibodies. And if these are elevated, these are markers that you have an autoimmune condition. That's where your own immune system is attacking the thyroid gland and can totally disrupt its function. And this needs to be addressed and not overlooked. And finally, two other markers that need to be checked that are critical for proper thyroid function is a ferritin, because with low ferritin, less than 100, your body can't properly convert T4 to T3. And lastly is vitamin D, which we need to be between 60 to 80, because it's critical to help make sure that your thyroid receptors are working properly. So while we're on the topic of labs, first, you need the right labs run, but more importantly, there's some nuance about how your lab should be done that will give you the best thyroid results. First, you need to ideally have your thyroid levels checked 4 hours after you take your thyroid medication. And why is that? Your thyroid hormones have a certain half-life, and the ideal for both your T4 and T3 is this 4-hour window. So what's important is if you take your thyroid medication, go have your labs drawn about 4 hours after. And why is that important? If you take your T3 in the morning, which has a short half-life, but you don't have your thyroid's labs drawn until 8 o'clock that evening or later in the evening, let's say 8 or 10 hours later, we don't get a good, accurate reading of what your T3 is. And if it's inconsistent, let's say this time you have your levels checked at 4 hours, and then 6 weeks from now you have it checked at 8 hours, that inconsistency is going to make it very hard to get the proper dose for you. Second, there's also some information that you need to be setting up for about 10 to 15 minutes before you have your TSH drawn, as this can make this number more accurate. And finally, biotin, the supplement that we recommend a lot for things like hair, skin, and nails, can actually make your thyroid levels be inaccurate. Ideally, if you take high dose biotin, probably anything more than a milligram a day, you need to make sure that you stop that 72 hours before you have your thyroid levels drawn, as this can cause false high and low thyroid numbers. So let's talk about all the crazy things that can make your thyroid just be wrong. First is stress. We talk about stress all the time and how important it is to keep our stress under control and our cortisol at a good level. And the reason that is because your cortisol has a dramatic impact on your thyroid. Your thyroid and cortisol play in the same sandbox, and if your stress is out of balance, your thyroid's not going to work as well. As a matter of fact, in the commercially available thyroid products that are prescriptions, it specifically says that patients should not take thyroid supplementation if they have uncorrected adrenal insufficiency. So when you're under periods of high stress and your cortisol goes up, it has three main things it does for the thyroid. One, it inhibits TSH. And if your body can't make TSH, it can't stimulate you to make thyroid. Second, it reduces T4 to T3 conversion. So if your body can't convert the T4 from the inactive form to the active form, you're going to have low thyroid issues. And thirdly, your body makes more reverse T3. As we said, if T3 is the gas, reverse T3 is the brake, and you're going to feel tired, run down, and sluggish because your thyroid just doesn't work as well. So as mentioned, during periods of high stress and high cortisol, your body does three main things to work against your thyroid and kind of shut it down. And there's a reason for that. It's trying to protect your body. But here's what happens. I see this a lot. When people are under high stress for a long amount of time, it begins to shut down their thyroid function. So they go to the doctor, they say, I need thyroid medication, and the doctor starts working up the thyroid dose. As you would think, the body, you should feel better as your thyroid dose goes up, but actually you start to feel worse. You feel more fatigue, you have more muscle aches and pains. And this is an indication that you're trying to push the thyroid harder than you should under a period of high stress when the body is trying to protect you. I see this a lot. So that's an indication as your thyroid levels go up and you feel worse, you need to go back and address the stress issue and not keep up on the thyroid issue. In addition, sometimes as we increase our thyroid levels, we see things like heart palpitations for these patients who are also under high stress. And one of the things I found is those patients typically are low in magnesium. If you normalize and replace magnesium while you're going up on the thyroid dose, this will help to minimize the heart palpitations and help with some of the problems that can occur as the thyroid dose goes up. Next, to have good thyroid function, you got to have a good gut. If your gut's not healthy, your thyroid's going to struggle. Thyroid medication is a microdosed medication. It means a very, very small amount of thyroid hormone is in each tablet. And if you don't have good gut function, you won't absorb the thyroid medication properly. And then trying to get your levels appropriate is going to be super difficult. Second, remember we talked about the conversion of T4 to T3, the inactive to the active form? About 20% of that occurs in your gut. And if your gut's not healthy, you don't convert your T3 there properly. Next, leaky gut is actually the cause of many of the autoimmune conditions, especially like Hashimoto's. So if you have a bad gut that's leaky, letting out lipopolysaccharides are these little messenger proteins that the body gets fooled and thinks that it needs to attack it. This can lead to a lot of the autoimmune conditions, especially things like Hashimoto's. And finally, if you don't have good gut function, you can't absorb the vitamins and nutrients your body needs for proper thyroid function and for your thyroid receptors to work properly. And finally, a couple other things that you may not have realized that can have a big impact on your thyroid function. The more obese you get, the more weight you put on, the less your T3 receptors get reduced, and you notice like thyroid issues. Environmental factors, toxins, pollutants, all have the ability to lower your thyroid function and not only prevent your body from producing T4 and T3, but block the receptors for T4 and T3, so you have low thyroid issues. Heavy metals can compete with iodine uptake, and that prevents your thyroid from working as well. You also need to make sure that we keep inflammation low, because if inflammation is increased, thyroid receptor sensitivity goes down, and thus you'll also have low thyroid issues. If your doctor does check your reverse T3 and you see it's high, and this is what's causing your low thyroid issues, we need to take a little deeper dive into what reverse T3 is and some of the things that can cause it. So once again, we can go back and treat the root causes and get your thyroid working properly. As talked about, your reverse T3 works against your active T3, and if you have too much reverse T3, this can cause problems in terms of low thyroid issues. Some of the most common causes of your body to make more reverse T3 than it normally should are things like chronic stress and high cortisol, inflammation, or if you have some underlying infection, insulin resistance, liver or kidney dysfunction. If you yo-yo diet, extreme starvation, or do an excessive low-calorie diet, that can make your body make for more reverse T3. Low ferritin or selenium levels can also trigger higher amounts of reverse T3. And believe it or not, certain medications can make you produce more reverse T3, things like beta blockers, certain SSRIs, which are commonly used for antidepressants, steroids, and something called amiodarone. So keep in mind, a high reverse T3 can leave patients with classic hypothyroid symptoms, things like fatigue, brain fog, weight gain, even though your TSH and your T4 are normal. It's the ratio of your T3 to the reverse T3, which is important to make sure that you have proper thyroid function. And if your reverse T3 gets too high, we've got to go back and look at those root causes and take care of those. So you've worked on the root causes and you still have low thyroid issues, and your doctor's going to put you on thyroid medication. So let's take a deeper dive into those so you better understand how proper thyroid supplementation can be the answer to your problems. The thyroid medications that are reversed via medications are bioidentical thyroid. It is pure T4 and it is pure T3, exactly like your body makes. The T4 is called levothyroxine or thyroxine. The T3 is called liothyronine, and that's T3. And those are exactly what your body makes, but they can be replaced as medications. There is a lot of data that show that many people do much, much better on a T4 T3 combo than just taking T4 as a monotherapy only. And you may recognize T4 as something called levothyroxine or Synthroid. But these studies show that when patients take both forms of thyroid, T4 and T3, they have better overall quality of life, better symptom control, and feel a lot better. And it makes good sense. We've talked about it. There are so many things that can go wrong if we just give T4. We require so many things in the body to be perfect, like stress and nutrients and all these things for the body to convert the T4 to the T3. So it only makes sense that we need to give some T4 and give some T3. The reason why we just can't give T3 only is because that's short half-life. We need to give T4 the building block so the body can convert some throughout the day, but we can give some T3 so we get the immediate benefit. And it's that combination that typically helps eliminate symptoms best and helps patients feel as good as they can. So another way that we could replace thyroid other than giving pure levothyroxine T4 and liothyronine T3 is something called desiccated thyroid. This is actually ground up pig porcine thyroid that's been standardized to have a certain amount of T4 and T3. Now, a pig makes about a 4.2 to 1 ratio of those two, where we as humans make about a 3.3 ratio to 1 of those two. So that's why this pig thyroid really works pretty well for a lot of patients. And unfortunately, a lot of doctors don't want to mess with the hassle of trying to figure out T4 numbers and T3 and what doses to give. So Armour Thyroid or Thyroid USP, or they may be called sometimes NP Thyroid, is a great choice for the providers to give a T4, T3 combo to a patient. There are other things that are in these products that also may have some benefit on the thyroid, but keep in mind the only thing that's standardized in these porcine thyroid products is the ratio of the T4 to the T3. The only issue I see as a pharmacist with these products is sometimes people can be sensitive to some of the other items that are in that porcine thyroid gland, things like T1, T2, which we didn't really even talk about those. But also, too, for some patients, that 4.2 ratio to 1 just doesn't match what their body needs. And so they may need a little more T4 or they may need a little more T3. And that's where compounding comes in, because we have the ability with compounding to produce pure T4 and pure T3 in any ratio. And what I like to say is let's get patients T3 and T4 numbers dead center of normal. And I like to be super sensitive with my ratios of T3 and T4 and what those normals are. I like to say, let's take the normal ratio and let's take off the lower 25% and the upper 25%. And we need to get our patients in that dead center of normal range. And this is where proper T4 and T3 compounding can come in, because we have the ability to make that in any dose that's needed. With compounding, we also have the ability to take and make the T3 part released slower in the gastrointestinal tract. As we mentioned, T3 has a very short half-life. And if you take T3 in the morning, sometimes by like lunch, 1, 2 o'clock, people start to feel tired and run down. We have the ability to compound a T3 and make it release slowly in the gastrointestinal tract so it all doesn't hit the system at once. And it allows that T3 to stay in the system longer. It gives you better relief with things like fatigue and tiredness longer throughout the day because the way the capsule is made. In addition, if patients can't tolerate certain fillers or dye, or even in that porcine thyroid, there is a little bit of lactose. If people can't tolerate that, the ability for us to compound and do a customized formulation for these patients who have specific needs allows us to give us more of a personalized dose for each patient if that is needed. All right, so you're talking to a pharmacist, so I got to tell you how to take your medications. And thyroid may be one of the most important medications that you take it properly. So first of all, you need to take your thyroid medication first thing in the morning on an empty stomach with a full glass of water. And ideally, you shouldn't take it with your coffee, you shouldn't take it with your orange juice, and you shouldn't take it with food. And you need to wait, ideally, at least 60 minutes, if not at least 30 minutes before eating or drinking anything else. Ideally, we want to wait probably an hour or two before we eat anything, because we want to be consistent with allowing that thyroid to get absorbed. Thyroid's very finicky. It's a small amount, and you have to make sure that it gets absorbed. And by taking it on an empty stomach, this allows this. The key is consistency. I have some people come in and say, Steve, I have to have my coffee in the morning. So all I say is if you have your coffee in the morning and you take it close to your thyroid, just do it the same way every day. So if your doctor checks your blood work, your level is consistent. The problem is if you take it with food one morning, with coffee the next day, on an empty stomach the next day, it is going to radically affect your doses. The next problem is that you have to avoid taking your minerals, especially but even your vitamins, your antacids, your fiber supplements, multivitamins away from your thyroid medication. These can radically affect the absorption. Up to 40 to 80% of your thyroid can get bound up and not be absorbed if you take these things at the same time. So typically what I recommend for like vitamins and supplements and things like that, we need to wait at least 2 hours, but the ideal is to wait at least 4 hours from taking those items around your thyroid medication. And another thing regarding thyroid medications is the quality of the product. You don't want to be taking this generic this month and that generic next month and this compounded this month. Thyroid is so finicky in how well it gets absorbed, and all of the things, even the brand and the quality and the formulation type, can affect your blood levels. And typically what doctors will do is they'll have you do a thyroid dose. It needs to get in your system. It needs to be working for at least 6 to 8 weeks before they'll check your dose again. And it's not uncommon that we're checking our blood work every 6 to 8 weeks till we find that sweet spot dose with our dosing, so we don't have to be checking this blood as often. But that can happen. But you have to be taking it, like you said, for at least 6 to 8 weeks before we make dosing adjustments or run that blood work. And finally, what are the vitamins and minerals that are critical for your thyroid to work optimally? First is selenium. Selenium is critical for your body to do thyroid conversion, but it actually can lower thyroid hormone antibodies if you've got things like Hashimoto's. Usually recommend about 200 micrograms a day. Next is zinc. Zinc is needed for your T3 to bind the receptors, and an average person needs anywhere between 25 to 40 milligrams of zinc daily. Next is ferritin. This is your iron store, and proper iron is so important because your body can't convert T4 to T3, and we really don't want a normal ferritin like in the 50s. We need a ferritin greater than 100 for proper conversion. Vitamin D is also so important because if your vitamin D is low, your thyroid receptor doesn't work as well. We need to shoot for that 60 to 80 range. And for most people I've seen, we need between 2,000 to 5,000 units daily. Finally is magnesium. Magnesium is critical for thyroid production too, starting out between that 200 to 400 milligrams of elemental magnesium daily in something like a glycinate or threonate form. And then finally, if you've got gut issues, we need to work on digestive enzymes, a good probiotic, and do the things to make sure that our gut is healthy. So wrapping up, if you have made it this far, I can tell you right now, you know more about thyroid health than your primary care provider does. And you think I'm joking? Go in and ask some of these questions, and I think you may stumble on some of the things we've talked about today. Remember, normal doesn't always mean optimal. If you feel unheard or dismissed, keep asking questions. And if your doctor only will run a TSH to check your thyroid, then you might go find another healthcare provider. And if you feel like this episode brought you clarity, be sure you share it with someone who really needs to hear it. Also, don't ever forget to subscribe, leave a review, and always keep fighting for your health. And if you're looking for the truth about how the body works, make sure to join us for the next episode of The Trusted Pharmacist.